I'm going to talk about, I'm very applied in my work. It's how I like to approach problems. And the challenges that we face right now with regard to AI are also coupled with great opportunities. So while this is not a SWOT analysis presentation, I am going to talk about strengths, weaknesses, opportunities, and threats with regard to AI with vis-a-vis public health practice, and with a particular eye to public health emergency preparedness. So, sorry, learning objectives, I won't, you can read these, but I do want to talk about just some key definitions along the way, describe how AI supports public health agencies in fulfilling the essential services of public health, and I'll describe what those are. At least one barrier, there are lots of barriers potentially, but at least one barrier to AI adoption in public health agencies for preparedness for emergencies and pandemics. And last but not least, current and future policy and practice implications of AI. Although there's not a disclosure slide, I have no stock in any AI company at all. So this is for level setting purposes, and many of you may be extremely familiar with the terminology, but just out of due diligence, I'm going to define some terms just for orienting everyone, because we're going to build on some of these concepts as I talk about how it relates to the work you all do and the research you do. So artificial intelligence is, I know it sounds like within the last 3 years it's exploded, but it's actually been around since 1955. Stanford professor John McCarthy was the originator of it. You know, if you've Googled anything anytime lately, there's an AI answer, right? And so that has great opportunities attached to it, but also some risks, and we'll talk about that. So just for brief orientation, by AI, we're talking about incorporating human behavior and intelligence to machines or systems. And there are sub-elements, so this is intentionally from the periphery of the ring to sub-definition. So there's machine learning, which is basically learning from data or past experience and allows for automating. And AI has been incredibly useful and will be, I fully predict, for model building. So a number of you do modeling. I've spoken to a few of you during the break, so I know that's highly relevant to many of you. And then deep learning uses neural networks. It approximates how the human mind works, which is kind of scary to think, but that is the idea. And with this collection of technology, there are tremendous opportunities and challenges in public health. So just again, very brief level setting, just so everyone is in full sync with the terminology I'll be using. An algorithm is basically, in AI world, lists the precise steps to take. So if you're writing a computer program, how many of you have used Python or written something? Okay, so some people are really advanced. Okay, well, AI uses, in many cases, Python for programming, but the term algorithm takes many forms. YouTube has a remarkable ability to find out videos that I didn't know I wanted to see. And so that's part of the Brave New World aspect. Generative AI is basically a class of AI models that basically emulates the structure of input data. And narrow AI has a more narrow focus, and by that we mean speech or facial recognition. I'm not even going to ask who's used ChatGPT, because if you haven't raised your hand, you're lying, because everyone's used it, right? So that's one of the sort of early, most common adopted AI technologies, and that's only going to expand, I predict. And then human level AI, or artificial general intelligence, really is kind of what we're going to be talking about today, where you have context-aware technology. So as I mentioned, I like to be very practical. And here are some practical, non-exhaustive, in fact, very abbreviated lists of examples of how AI can be used in public health preparedness. If you do, for example, spatial epidemiology, you can leverage AI to map cooling towers for Legionnaire's disease outbreaks. You can use it for telehealth, so it has relevance to global health potentially too. Diagnosis of, for example, chest x-rays. Monitoring COVID-19 vaccine safety or other vaccine safety. One of the terms we're going to talk about in a bit is called agentic AI, which is basically, I can say, I want to write a report about COVID-19 in, I don't know, Banff, I just made up a city, between outbreaks between such and such a time, and I'd like to prepare a report about that and an executive summary, and then send an email to the health executive or health officer. That multi-step process is agentic AI. And what I think is we're going to see more and more of is that sort of one-step everything, sorry I didn't mean to snap so loudly, but at one-step sort of process where you just say, I'd like this, this, and this done, and AI delivers that. But again, I'm going to introduce a lot of caveats. So, a very useful approach for AI, I think that's going to be a game changer, are dashboards. So obviously, a mutual colleague of one of our attendees, Lauren Gardner from Johns Hopkins, led the development of the COVID-19 dashboard. Artificial intelligence is going to put that capability on steroids in terms of near real-time recognition. Now, I'm going to use a phrase that's important, and it's a bit crude, but garbage in, garbage out is a phrase you've probably heard. And a more sort of tactful way to say that is inputs matter, right? So you need good data and good data sources. So the COVID dashboard was fantastic, but more, it took more work than an AI system would take because of the automaticity of AI. So my point is that quality of data is going to be absolutely critical, and that's one of the biggest threats, frankly, in the landscape of artificial intelligence and public health preparedness. Because we have a lot of data streams, some are high quality, some are not so great, and there is a risk attached to that I'll talk about. How many of your jurisdictions, just out of curiosity, did wastewater testing, sampling? Okay, so COVID AI can be greatly beneficial for, as an adjunct to that kind of epidemiologic workup. Genomic sequencing, zoonotic and One Health feeds, monitoring spillover, for example, from animal to human. And even another avenue is looking at social media feeds and seeing in that bidirectional listening of what the public is asking about. I like the earlier comment that, you know, only old people watch TV anymore. Well, that social media is the way of the future, and currently a lot of people get their news, as you know, from TikTok and other social media avenues. So the caveat here for multi-stream surveillance is that we need robust cross-sectoral collaboration and data sharing. And so some of the comments earlier about interprovincial data sharing and pharmaceutical data and so forth. Let's just say I can relate from south of the border as well. But the idea here is we need more harmonized interstate / interprovincial data sharing to allow for that sort of quality data. Now, having said that, Google flu trends, is this being recorded? Please don't rely on Google flu trends if you're doing flu monitoring by itself, certainly. It's fraught with some problems. So again, There are a lot of highly used data sources, but we have to be, parsimonious and thoughtful. By we, I mean the world, in terms of what we use, and not to rely on just one data stream. So I mentioned agentic AI. That's kind of the most powerful in many ways of AI modalities. That's the example I mentioned earlier where, please write me a white paper on this topic, then make an executive summary and email it to the health officer. And it does all of the above. I know some of you are epidemiologists, and I have a colleague at Hopkins, Ben Hyun, who we were talking about this, and he said he used to pull all-nighters doing this kind of work. And Howard may be able to relate to the all-nighter concept. It's not just for college students anymore. And the idea here is that, just the grunt work of data entry and all of that is alleviated in many cases now by AI. So less burden for epidemiologists. Rapid turnaround time. I'm very careful not to say real time because it's near real time, but it's pretty close with its potential. But a caveat with all of this, how many of you may have heard the term AI hallucinations? So that's a problem because AI can say something, or AI generated fact or statement can sound very authoritative, but it can be factually wrong. And so one of the concerns is the need to discern, and that's why I'm going to get to this in a moment. I was talking to Eileen earlier. There's a human aspect that cannot be replaced. And one of my concerns is that AI is turning into sort of, in many cases, or thought to be a substitute for human expertise. It is not and never will be. So we need epidemiologists, in other words, because if something's an AI hallucination, we can make totally wrong decisions based on bad information. And cybersecurity is a big issue. So a cyber attack against an AI system that's used for preparedness is like a cyber attack on steroids, because all the power that AI has can then become targeted itself. So again, kind of a threat matrix, if you will. How many of you have done tabletop exercises or written them up? Okay, so I have no stock in, as I said, in any company. There is I have a colleague who I met at a recent conference, Justin Snare, who has developed something called Prepper AI. You can basically do A to Z public health. It's again, I'm just spelling this in case you're looking up. PREPPR.ai. And what blew me away is that this allows you to design exercises, do injects, and all of the above. It's almost essentially automated. Again, it requires human expertise, though, because if you have a factually incorrect, and he would be the first to acknowledge that. So it's not just useful for tabletop exercises, it's also important for creating libraries of pathogens. So I gave a talk yesterday in Dallas, and they had sent me, on AI actually, so I rehearsed my own talk yesterday through that talk. But the point is, they sent me a packet called FIFA stuff. And that's kind of a scary subject heading of an email, FIFA stuff, and they said, could I speak to the use of AI to plan for FIFA? And I said, well, how much time do you have? So the point is, we can use, though, seriously, these models to do hazard vulnerability assessments of leading potential pathogens for mass gatherings, and that's very germane to planning. So AI allows us to do this at speed. But it doesn't account for, and this is the only time I will quote Donald Rumsfeld, whom you may or may not know, there's the unknown unknowns. You may recall he said that. That's my one and only quote. AI does not allow us to plan for the unknown unknowns. So CRISPR, for example, right? There are engineering, biohazards and biothreats can be engineered by malignant actors to have brand new incubation periods and other properties that we've never seen before. So AI doesn't account for that unless you factor that in and model it. And that's one of the things that is sort of a limitation. But having said that, we do know, so in that FIFA stuff packet, they gave me, I'm sorry, I'll never forget that email. It was one of the most daunting emails I ever got. But they listed all of the different potential outbreak scenarios. And it was their hospital epidemiologist who sent me that, so even more pressure. But the point is, a whole listing, right, of the various likely potential infectious disease scenarios. And so I spoke to that yesterday, and you know, I think based on what they're doing at University of Texas Southwestern, this is the kind of thing that can benefit from AI. And I know Toronto is also a host city. So again, this is not guidance. This is just so you know what's out there. Okay, so this is still on the US CDC website, so I'm going to show it. And it has equity at the center, and I'm not going to say anything further about that. But this comes from several years ago. The CDC, for the first time in over about 20-some years, updated what they call the 10 Essential Services of Public Health in partnership with the de Beaumont Foundation. And I want to highlight, and this relates in some ways to Howard's excellent list of relationships between governmental policy and AI and other technological aspects. So, love this diagram. Hope it stays on the site for a while longer. I'm going to still use it even if it doesn't, because it's very useful, I think. So this is, there are basically, there's a lot going on here, but it's basically a wheel, as you can see, with wedges for different critical peripheral areas. Assessment is one of the large domains of essential services in public health. Policy development is another, and then assurance. So what I thought I would do is kind of target or propose wedges within this wheel that relate to AI. And again, this is just my N of one perspective on this. I'll be interested in other alternative thoughts, as you may have. So, a few of you mentioned one of my areas of interest is psychosocial aspects of disaster preparedness, response, and recovery systems. So, the impact of behavioral factors, vaccine hesitancy, for example, right? All these various things that we need to include in our analyses and systems. And just to highlight, one of the things that we can do with AI at high speed is to assess and monitor population health. I know that's like 50,000, I'm going to use meters since I'm in Canada, 50,000 meters. So, but it's important, right? We can apply that. Okay. Let's talk a little more about assessment. I alluded to the cooling tower mapping example for Legionnaire's disease, right? Well, investigating, diagnosing, and addressing health hazards and root causes. So the incubation periods are going to be what they are, right? But historically, it's taken pre-AI about 1 to 2 weeks to assess the incidence of something between the outbreak and recognition. So public health is always playing a game of catch-up in that regard. AI narrows that window. And so that is a huge value add. So that's the assessment part of the wheel. Okay. Policy development. Communicating effectively to inform and educate. So one of my hopes is that AI is going to become a requirement for students in schools of public health, at least orienting them to that. Not because I think that AI is the be-all and end-all, but I think it's an essential part of the armamentarium that we need to be aware of. So Others may disagree, but I think AI is not going away. There's mixed views about AI. I don't think it's a dot-com bubble, for example. I think it's not going away. And so therefore, this is part by policy development. I think that also includes education. Also includes training for the public health workforce and healthcare workforce. Okay. Assurance. So building and maintaining a strong organizational infrastructure for public health. So I was impressed, in Canada you have the AI4H, and then there's the AI for public health, and then I read there's a Bill C-27, I think it is. Yeah, I did some homework beforehand. I want to make sure I talked to it. But yes, so you thought about this, right? So the key is to how do we sort of bake it in? And that's a challenge in the US right now too. I've seen at least 2 editorials in the last week that the last line was not great. It said Congress needs to get moving. And that scared me in itself. But the reality is we are not where we need to be. The technology is ahead of the policy. And that's a big concern. Let's talk a little bit about data challenges. And actually I saw this reflected in my taking just a perusal of Canadian policy and US current doctrine, which is doctrine in air quotes, because again, the technology is ahead of the policy in the US and elsewhere. So data challenges. One of the things we have to be concerned about is bias. If we have data sets from segments of the population that are overrepresented in the data and others that are underrepresented in the data, that can exacerbate health inequity, going back to the diagram. So in the field of preparedness, I'm talking to the choir, that's why I love this audience, because interoperability, I don't have to explain what that means, but the idea is, we need to have interoperability among AI tools so that different agencies and stakeholders are on the same page. AI is a black box. I don't think I'm going out on a limb by saying that. At least if you're Sam Altman, it's not a black box at OpenAI, But the reality is, for the general public, I don't know how my YouTube videos come up the way as I mentioned earlier, right? But it's based on very sophisticated algorithms. So I think part of the challenge in terms of engagement is engaging the community, the general public, in terms of understanding what AI is, how it works, and not in terms of high technology talk, but explaining how things are arrived at. So that's a challenge and frankly a threat in the absence of that. I should mention also, as a side note, one of the concerns I have is going back to AI hallucinations. That can have a cascading effect on infodemic issues, right? So AI says something confidently and it becomes its own echo chamber that then propagates. So these are things, to be unfortunately on the lookout for. And I hope it doesn't materialize as I'm describing, but I think we need to be on the safe side in planning for it. Data protection. So one of the issues in the U.S., and I'd be interested in your perspective in Canada, is private health information, right? How do we sort of get good data while at the same time protecting health information? Now, in the U.S., for example, if there's a disaster, that a lot of those protections, I hate to say, they don't go away, but they're loosened because for population health reasons. But this is a really critical regulatory and frankly a bioethical issue too. Human factors. So I can't overstate the importance of AI being an adjunct and not a substitute for human expertise. Unfortunately, we're seeing, again, I'm not going to go into the weeds. I think you know where I probably stand on some of these issues already, but the idea that AI can replace people. Now, the reality is the sort of frontline reality is that that's going to happen, I fear, in non-skilled domains. For example, clerical staff, an email can be written, right? A voice can, and I hope that doesn't happen. But the areas in public health that I think are irreplaceable are basically everything you all do, right? And so I think that's one of that sort of caveats that we need to factor in. Also, interpreting AI outputs, right? So AI can give us a whole range of potential threat scenarios and likelihoods, but how do we use the human expertise? There was an article, a peer-reviewed article, and I'm blanking on the journal, but it was a little while back, where they did a study looking at radiologists. And it was kind of like a case control where they had AI diagnosing radiographic images and in lieu of the radiologist. And what happened is the radiologist got rusty. And that's a big concern because one of my fears, I'm not an anxious person. I may sound like I am from this talk, but I'm not. But so this is legit. Is that we're going to become reliant so much on AI that we will then get rusty and not keep sharp the skills that are necessary to use AI effectively. Does that make sense? Okay. All right. So we talked about data privacy and security, equity and bias. Those are real threats. I'm going to talk a little bit about environmental justice issues. So AI data centers use huge amounts of energy, huge amounts of power, huge amounts of water, and they're big CO2 emitters. And so there's a lot of environmental justice issues, for example, in the US. The phrase NIMBY, not in my backyard, is very rightly mentioned because this is a huge energy issue and environmental issue. I'm just going to highlight this in a little more detail. So this is also a challenge from a public health preparedness standpoint. Because AI data centers rely on power, I'm going to ask a very basic question. What happens if the power goes out in a disaster, which never happens, right? So that's a problem, right? So relying on this magnificent quote-unquote tool that itself is a vulnerability, not just from a power outage standpoint, but the cybersecurity standpoint, big threat if we're doing a SWOT analysis. Okay, so what are some potential strategies or opportunities for overcoming some of these barriers? And some of these I saw very well elucidated in Canada's AI for public health and AI for health. One is bias mitigation. I'm going to go into more detail, but these are the four broad buckets, I would say. This is not exhaustive, but in the interest of time and slide space, these are the four major ones. Bias mitigation, ethical data use, diverse funding, relates to health equity, by the way, and interdisciplinary teams. Imagine that. Our field is nothing if there's not interdisciplinary work going on, right? I'm talking to the choir about that. But the use of AI with regard to our field has to be interdisciplinary too. Meaning we need experts interpreting data, providing good input in terms of data, and the list goes on. So let's talk a little bit about each of these briefly here. So bias mitigation, that means inclusive data practices. Sorry, it's a little small here in the font, but diverse data collection. So not just from large cities, but small towns, right? So one of the concerns is the urban-rural divide in the US, for example. We have hospitals that are closing. So there's just inequity galore, and we need to factor that in. Another aspect, I mentioned ethics. This is, how many of you are bioethicists? Any, or like, I knew Brian was. So Brian, right? So even if you're not a card-carrying bioethicist, this is relevant to you because it relates to how we're going to have to factor in AI in an ethical way as we move forward in public health preparedness, response, and recovery applications of AI. Regulatory compliance. So this is a big issue that we have to factor in. We need the regulations sort of firmed up in many cases, but compliance with them is a whole other matter. Community engagement. I know that sounds trite, engage your community, but this is very, very important because I think the group that's going to be left behind in this whole Brave New World, to use that same phrase again, is the community that doesn't necessarily understand how their data is being used or how the algorithms or the things that the guidance that they receive is being derived from AI. And of course, there was no issue relating to trust in the US during COVID-19, so I'll skip that. So my concern about the AI hallucination is that if we become over-reliant on AI, we're going to see that distrust on steroids, if that makes sense. So again, this relates to risk communication. So AI is not a substitute, again, for the, I think Eileen and I were talking, it's the soft skills, the human skills, that interactive aspect. It is not a substitute for that. Public and professional education, I think this is kind of a direction, as I mentioned earlier, that is really critical to consider because this is not going away. AI is not going away. I don't know how it will morph or maintain, but it is here to stay, I predict. And then this involves M&E. This involves monitoring and evaluation. AI is like one of those literally potentially runaway trains. You can kind of get that vibe about it already, probably. And so we need to have, we need to keep a handle on all of its implications and also track how it's being used or misused. And so I think that needs to be built into policy. I also think we need frameworks like SWOT analyses. I know that sounds very basic, right? But that's something that I'm working on with some colleagues from Hopkins right now, a concept paper on, imagine that, a SWOT analysis of AI for public health preparedness. It sounds so simple, but when I looked and saw, was there please don't write this in advance of me and scoop me, we're almost done with the paper. But seriously, so, I looked online, I looked on PubMed, there was no paper that just framed it, which is shocking, was shocking to us, right? All right, so there are, as most of you are probably aware, if not all of you, there are publicly available tools. Google Colab is useful for machine learning modeling. How many of you have used Tableau Public? It creates these great visuals. So if you're a visual person, and these are all free. No one's used ChatGPT, as I mentioned earlier. But no, seriously, that's I think one of the most powerful and widely used tools. Have any of you used Google Earth Engine out of curiosity? Okay. So geospatial analysis, I think that's going to be one of the key frontiers that AI is going to really be a game changer with. So taking this great GIS technology that we have and really improving geospatial analysis with it. But again, based on good data. All right, so to conclude, and I want to save time for questions, I'm just going to highlight, this is a non-exhaustive list. And these are not answers, these are questions, if you will. So Key considerations and frameworks for AI and public health preparedness. So lots of use cases, right? Clinical care. Dr. Razak talked about the VITAL program, for example. Public health and operations, right? We need guardrails, though. Those guardrails do not yet exist. And accompanying those guardrails, we need to factor in ethical considerations and then data protection. This is a big concern for the public health workforce, I can say, in the US. I'm interested in your perspective in Canada, but concern that AI will replace public health workers. And again, it's above my pay grade what's happening right now, but I will say that that is a very scary proposition because we need those experts. We have GS-15 people who have had a lifetime in the U.S. government. GS-15 is like the highest. And again, I'll stay apolitical about it, but it's very concerning when you see people who are true experts at this being potentially replaced by AI. So I won't say further about that. This is a big issue. I'm interested in your perspective in Canada, an environmental justice issue, these data centers. Often they are located, surprisingly, not surprisingly, in low resource communities, right? So it sort of exacerbates inequities. Couple other quick things I want to highlight. Data limitations, and this is not a sarcastic question mark. So I call it the COVID hangover effect. One of my areas of interest is burnout, for example, among public health and healthcare workers. So, while we're in an inter-pandemic period, right? We don't know when the next pandemic, there will be another one, but when it will be. What I'm concerned about, among many things, is the lack of having caught up to lessons learned from COVID and applying those lessons so we can use AI effectively during the next pandemic. Does that make sense? It's like we're behind, 2 steps behind where we need to be collectively as a world. So this relates to emergent threats. Obviously this is a leading candidate for the next pandemic, but it's not the only one. And we need more forward-looking research. So as colleagues here know, I love collaborating. So I'm really interested in the work that you're doing and collaborating. Okay, very briefly, there are 3 buckets that I want to highlight in terms of moving forward. Data and privacy challenges. Okay, so, and again, that phrase, the unknown unknown, so that's a data challenge. Privacy laws, and again, the data can be compromised during a disaster for the very reasons we talked about. Redundancy is actually a good word in our field, right? We don't want to just rely on AI or electronic, right? Nothing wrong with paper-based backups, right? So the idea here is that I want to highlight that AI is not a panacea. I mentioned the urban and rural divide, and I think we need more research on this piece, the fragility of AI. I think that the gestalt is that AI has no fragility, right? It's incredibly exponentially expanding tool that is going to outstrip human capabilities. But I think that's a mistaken assumption. I think we need to take a very close look at how AI is being used to factor into the workforce in public health, not just in the preparedness domain, but in general. Frankly, as someone in academia who's training the next generation of public health workers, I'm concerned about people not wanting to go into public health because they feel that their jobs are substitutable by technology. Maybe I'm over concerned about that, but I don't think it's that far off. And so we need to really factor this very much because we need this expertise critically. I want to highlight this distinction. I love, by the way, you've got the whole disaster life cycle here. Nelson, I'm going to give you credit for that. Whoever came up, yep. So AI, I haven't even talked about that, but AI is relevant to all 4 phases of the disaster life cycle. And to this point here, I'm going to, in this particular instance, I'm going to distinguish between preparedness versus response. AI is wonderful potentially for preparedness, but if you lose power, not so great with response. So for reasons we talked about. And so I want to highlight again that we need really evidence-informed policy. To your comment, Howard, earlier, I love evidence-informed and not evidence-based. I think evidence-based is an overused term and inaccurately framed. Evidence-informed policy, and that's where we need more research. And here are some references. And I want to acknowledge my colleagues, Dr. Mativanan, Dr. Hyun, and Harshita Lingangauda, and happy to take questions. Thanks very much.
I really learned a lot, and thanks for saying that we will be sticking around.
Thank you.
So it's time for questions. So just raise your hands when we will pass the microphone around.
Hi there. I'm an economist, not a public health person, so I'm coming at this a bit naive, but how would, what data points would a model, AI model, use to predict the next pandemic? What would the actual underlying data look like?
That's a great question. So you could, there are a few different answers to it. One is patterns of transmission, novel pathogen identification for which there's not prior human immunity, as another example. Other patterns that that are potentially relevant are out of seasonal cases of flu. So sort of things that are happening at the wrong time. And so AI, to your excellent question, AI can allow us to identify those pattern variances in much more rapid fashion than we ever could before. And so that's how we can leverage AI to assess that something concerning is going on, such as a pandemic. So, but again, it requires expert interpretation of the data that's coming in. And it needs to be high quality data. Yeah, please.
Follow up though, I mean, these things are not found on the internet, like this, these unusual viruses that pop up from time to time. These wouldn't be captured on a Google search necessarily. They would require dedicated public health
Correct.
Data sets. So I guess it would be kind of a closed off AI system.
Well, so yes and no. So on the one hand, for example, World Health Organization and countries around the world, they have, things that are not necessarily projected to the general public, but they're doing close monitoring in the background 24/7. But those online searches, for antipyretics and other kinds of things that, antidiarrheal, other kinds of things can be adjuncts to those closed systems so that we can fuse them, and that's called data fusion. So really, both of those things. Great question.
Thank you. I'm going to be Canadian and polite and say thank you for your lovely, provocative talk. And I'm curious if there are some examples outside of North America where you think application of AI for emergency preparedness or response is being done well. Where are some examples we can look to learn from?
Yeah, great question. So the UN has, for example, in the humanitarian health space, they have their own dashboard, for example. There's a food insecurity dashboard globally, and other examples. Interestingly enough, I was looking at, ironically enough, the other day, I haven't seen a U.S. food insecurity dashboard. I'm curious, is there one in Canada or, so these are the kinds of things that exist, but I think AI can put them at speed to your question. So there are examples out there, but they're not necessarily as real time as they could be. Great question. Was that helpful or clarifying?
Thank you for your talk. I just wanted to give some context. So I'm a PH student. So I wanted to touch briefly on your point about education. And I'm going into my second year, so I just finished up my first year. And I think the concept of AI in our sort of course and program has been very mixed. We have some professors who are very pro-AI and some professors who refrain from sort of, I think more of an academic context is where we've been really discussing AI. So AI for our assignments and our essays and our paper, like our research proposals.
Right.
And the piece that you talked about, like learning for AI for public health, is something that I was interested in sort of hearing more about your thoughts on how we could possibly implement this in the education curriculum. Because I would say, I haven't encountered a lot of conversation around that piece. It's more over like AI in academia. So just want to hear your thoughts.
Well, it's a great question. So I think a lot of these concepts that we're talking about today aren't necessarily, at least at most schools in the US that I'm aware of, for example, are not routinely introduced as part of public health practice considerations. Now, to be fair, this is all very relatively new, but I feel like and there are some programs in the US that have you can get an AI certificate in public health. And so they're emerging, but I think to have it more systematic and across the board would be, if they ask my suggestion box idea, would be my recommendation, because I think it's something that all public health students are going to experience eventually in their careers. So the more we can at least give a framework for the potential and perils, if you will, at the same time of AI in public health practice, the better. But I think a lot of it's been focused on sort of, don't use ChatGPT for your essay, right? And so that's a whole other set of ethical and frankly academic administrative considerations. Great question.
I'm going to supplement, add something to what Dan said in terms of, what could or should be taught, in the educational system, schools, et cetera. AI. This is my personal view, so here it is. 2 other courses I think that should be taught in schools everywhere, US, Canada, and around the world, is how to critically appraise and use the internet. In terms of just, we talk about the scientific method, et cetera, in terms of, in terms of the, science, in terms of what the criteria, causation, effect, but just critically how to use the internet. I've seen the movie Contagion, right? Where, some person looks at it and goes, oh, it's a one-to-one debate, the head of the CDC versus this blogger in his basement. It's crazy, right? But that's the kind of level of discourse. And the other one I would say that needs to be taught, and I think there might have been a course way back when, is Civics 101. What is it that, you as a member of society, a community, whatever, what does a government or whatever owe you in terms of, essential services, repairing the roads, et cetera, and so on? But what do you owe as a citizen in terms of the collective, right? And I would say that's one of the biggest things that I personally observed during the COVID-19 pandemic in terms of social cohesion, trust in government, listening, et cetera. Look at how some of the Asian countries did, Scandinavia versus, not to disparage, but the U.S., right? Or the other extreme, right?
Talking to the choir.
So there you go. Those are the kind of things that are floating around in my head in terms of some of the things that, could or should be taught. And then in terms of data inputs, I think the question about, how does AI fit in other sources of data? It's interesting, I looked at Michael here, one of the things that was sort of criticized or talked about during COVID was the system was actually invented in the Public Health Agency, and then the WHO and others used it, was GFIN, right? The Public Health Information Network, and people thought it was this great big, whatever algorithmic thing. Essentially what it did was just looked at, quote, things are in the public domain in terms of newspaper articles, et cetera, and so on. Because at the end of the day, what might be a public health event could just be a news story, a new human interest story, right? So suddenly if there's an article in a local paper in China that half the students are missing school because of a mystery illness, is that nothing? Or is that maybe it's sort of the first hint of something else going on, right? So that's really what it is. And then here's the other element where, I guess in my world, the other people that need to start connecting more are between public health and the health intelligence or whatever, I mean, the security and defense sort of intelligence communities, because, excuse me, first came to the forefront with the anthrax incidents. Suddenly, and here's the, I'm not sure if it's true, but this is sort of the anecdote I heard that, when they had the white powder incidents at the National Enquirer and so on, there were practically fistfights there because, two different paradigms. People came on to see, Michael's laughing, others know this, right? You have the CDC coming with their typical public health paradigm. We're going to, swab the keyboard, send out for a lab analysis, etc., do the epi investigation, talk to people, etc. And then all of a sudden the FBI shows up and goes, whoa, this is a crime scene investigation. There's a chain of custody of evidence, etc., right? And how do you bridge that in terms of understanding, appreciating how they could or should work? And so they then had that workshops of how to have these people understand and learn and be able to collaborate. And we had to do the same thing in Canada. So I had to, work with certain agencies, etc. And that's the lessons learned that hopefully be in the future. And even now, in the last days when I was at the agency, you had certain people with certain clearance getting information from sort of the defense intelligence. And here's the human element that AI might not necessarily be able to do, but who knows that in the future, is that suddenly you get this maybe piece of intelligence coming across the wire to some defense analysts. They wouldn't have a clue. It's suddenly, oh, look at this, the Chinese army is surrounding this village in China. I was using China as an example. And the first reaction from the defense person would be, oh, there might be an insurgency, maybe there's going to be a protest or whatever, and they're going to round up all the people. But as an epidemiologist, you might think, oh, maybe they're quarantining the village because something else is going on. So there you go.
Absolutely.
Okay, I'll go quickly because I know there's another question. So I think a lot of this is really useful, and I'm trying to think what are some barriers for me personally to use this. And I think sometimes our organizations haven't yet adapted in what they search for, either in our workforce or as our leaders. So I'm curious to get your take, knowing all this research, what are some of the top competencies of people who use AI really well, and how do we then put that into our trainings?
Terrific question. So I'm going to put on my researcher hat. We don't have enough good research on that. I'm not punting that answer. Having said that, I do think, for example, epidemiologists, those skill sets translate very well into asking the right questions. And I'm not just saying that because there's I'm not trying to score points with epidemiologists here. But asking the basic bread and butter epi questions they translate well into asking the right questions via AI. So that's why I think it goes back to a comment I had made earlier that these skill sets are not replaceable with AI. The inputs are informed by those essential fundamentals. Is that helpful or clarifying? Okay.
Thanks so much, Dan, for your presentation. Yasmin Khan from Public Health Ontario. I think my question sort of is the same vein as Nicole's last question, just sort of on the practicality and AI for those in public health agencies doing preparedness work. I feel like I heard throughout your presentation mention of exercises, like kind of risk assessment as key topics. Like, would there be anything else that you'd see as like really jumping out at you in your conceptualization of AI for public health emergency preparedness that public health agencies could or should be thinking about right now?
Yeah, great question, Yasmin. I think another area that I didn't mention is incident command. Sort of how do we identify in real time who is we used to use call down trees, right? And still do. But the idea of sort of identifying surge capacity in real time, that's another huge value add. Just in the US, and I know in a lot of countries, maybe Canada too, I don't know, but agencies are being forced to do more with fewer resources. So to the extent that AI can build that sort of identification of efficiencies and who's available to do what, that can be a huge benefit in the response and even recovery phase, I think. Great question, thanks.
Last question. So it's a good question. I mean, we're all worried about the loss of critical thinking, right? And in Ontario, we had a little experiment. High school students were locked down for a couple of years. That was the entry point for students who then would come to university using ChatGPT because it was online. Mm-hmm. They developed working groups, how to disguise that you're using this co-author, wow. Right? So don't use dashes, don't use this, don't use that. So living in a world with generative AI means learning how to speak in your own terms at some level, right?
Mm-hmm. Yeah, that kind of gets to another vulnerability of AI, is that how AI can be manipulated in terms of disguised, we've heard about deep fakes, for example, and things like that. So that falls definitely under the threat category. There are a whole array of potential malign uses of AI or manipulative uses of AI, not just that can inadvertently lead to the misinformation I talked about, but actually for disinformation. I think that speaks in many ways to the concerns you're describing, Brian. Very, very apt.
Okay, thanks Dan for this very insightful talk.